Welcome to this talk on arthritis and how to manage and overcome it without medications and surgery. To begin with, the first question I would like to ask Dr. Jolly is, what are the different types of arthritis?
See, arthritis means an inflammation of the joints. It can be due to due to infection or an autoimmune disease. That's the most common. This rheumatoid arthritis, rheumatism. It is actually an autoimmune disease, and it can be degenerative. That is the another very common disease is degenerative. That is osteoarthritis. That is for the osteoarthritis, most of this knee replacement and hip replacement, all these things are degenerative actually. These are the major categories of the arthritis group.
See, how does one come to know through what symptoms that the person has arthritis or osteoarthritis or rheumatic arthritis or any of the different forms?
See, symptomatically, joints and the joint capsule and all is very painful when it swells or any problem comes. So the first sign will be pain. Next, it can be swelling also. That will be edema and swelling can occur, and also redness. Especially redness is there. We should be more careful that whether it is an infection oriented. But otherwise also rheumatoid arthritis and even rheumatic fever, the joint swollen and redness can occur. When you come into the investigations, that is a simple thing is to see what is happening in the bone. We can take X-rays, and nowadays the CT scan and MRIs actually also soft tissue ideas we get more with the MRI. And even the spine, we take that vertebral column. MRI is better, much more better information you can get with the MRI. But for the knee joint, even the deformities, to find how much deformity is there, this X-ray also will be helpful. And when you come, that is the scans actually. Then when you come to the blood test, you can see the inflammatory markers. Inflammatory markers will be high with the infection and also with the autoimmune diseases usually. The infection is actually rare and we will be knowing most probably it is not a very serious or more common entity. Usually infection comes with some injury or some wound and all. So most problematic or the most common joint problems is with the autoimmune disease and degenerative diseases. And it is actually the latest findings also show that there is an even behind this degenerative activity. Degenerative usually we call it as osteoarthritis, and also the disc problems of the spine also. We take it as a degenerative disease, but latest understanding, the scientific understanding increases that also have an autoimmune or immune system is associated with that weakening or the degeneration also. Then the other thing is the most common is rheumatism. Rheumatism itself can be this rheumatoid arthritis can be there, and also the most common autoimmune disease associated with the skin lesions, that is psoriatic arthritis. This rheumatoid arthritis and the psoriatic arthritis goes almost the same, usually the same symptoms and all. But in the psoriatic arthritis, there will be skin manifestation also will be severe. And also usually the rheumatoid arthritis is symmetric. So both the joints of both sides will be affected. Usually, it can be variations. But in this psoriatic arthritis, one joint may be affected, the other may be shoulder, or any joint can be also affected. Even the spine manifestation will not be that much in the rheumatoid arthritis, but The vertebral affection also can be there with the psoriatic arthritis and other sort of this collagen vascular disease. It's a big group, including this rheumatoid arthritis and SLE, the systemic lupus erythematosus. And there are so many collagen vascular diseases are also connected with, can also manifest joint symptoms also. So it's actually a large group with rheumatism and degenerative diseases and all.
Actually, when we talk about this arthritis, rheumatism, and osteoarthritis and all that, normally we associate these problems to the slightly elderly, or at least beyond 50 and all that. But we also see that some children are also affected by this arthritis, rheumatism and all that. So in the case of children, what is it that, how should we see it?
See, children arthritis is usually, we call it as juvenile arthritis. Juvenile usually it's autoimmune nature. That usually occur after some allergic, the child gets recurrent fever or cough or sneezing and some sort of allergic reaction, or some viral or usually viral infections. After a viral infection, it starts actually. So there is even this, another example is rheumatic fever. Rheumatic fever also attacks the joints, mainly children. The rheumatic fever actually, the problem is actually it's a bacterial infection. It can be a tonsillitis affecting the throat, or a caries or a damaged or infected teeth. The infection is created by the streptococcus and streptococcus bacteria, and our body is making antibodies against the streptococcus. The problem with this antibody is this streptococcal cell wall, that bacterial cell wall, and this our collagen has some certain similarities. So what happens? This antibodies which is created against this streptococcus infection is start attacking our joints and also the heart. In the rheumatic fever, if the child is getting rheumatic fever, the joint will be cured, and after some time, after some painkillers, and the joint will get cleared after that attack. But this streptococcus infection of the tonsil or the caries, the tooth infection, it will recur and it will gradually damage the heart valves. That is the reason for most of this valve replacement surgeries like mitral valve replacement, and that is very commonly, it is not commonly done, but it is in a cardiac unit. That is one of the valve replacement. That is the one of the major reason is this autoimmune disease, which is actually the autoimmune nature is starting from the infection. It is triggered by a bacterial infection, and when this goes on recurrent, this joint problem comes, the heart is actually there is a say actually when we are in the medical students, there is teachers teach basically that the rheumatic fever licks the joints and bites the heart. That is the term used actually. So that means it is rheumatic fever. That is actually, you are seeing only the joint, fleeting joint arthritis actually. So one day it will be morning in the elbow, next day it may be on the right leg, and next day in the left leg or in the ankle. So it is always changing actually. So, but finally it is actually, it bites the heart actually. It is only licks the joints and goes off from the joint. But the permanent damage is done to the heart. So it is likewise, most of these rheumatic disorders are actually not confined to the joint alone. It can affect other systems because the collagen, that is the it's a type of protein, it is there all over on almost all the organs. So it can affect any part of the body, and even the eyes or the heart, the blood vessels. Blood vessels also, collagen is an integral part of the blood vessels. So any part can be affected. That is the problem with this autoimmune diseases, especially rheumatism.
How does this this joint deformity happen? Because generally speaking, initially it starts with some pain, swelling, and some medication is taken for pain, and initially that is the way people generally start with management, but then it slowly changes over to causing deformity, fingers and toes and etc. So how does that happen?
Actually, this pain comes as a inflammation. Actually, that we generally in the medical terms we call there are 5 cardinal signs of inflammation. So initially in the Greek or Latin words we are using calor, rubor, dolor, and such things. That is basically it is a pain. The symptoms for any disease, the 5 cardinal symptoms will be there. One is tiredness. Initially, it can be tiredness. Then pain comes. Then redness can come, and fever, and swelling. These are the 5 signs. For the arthritis, usually the first comes is the maybe tiredness or the joint pain. Then swollen joints and can redness also come. That is the, and along with that fever also can be there. So that is the almost all these 5 signs will be there in most of the, or 1 or 2 or 3, whatever is there. So when there is an inflammation, that is actually our in rheumatism. What is happening is our rheumatoid arthritis or even juvenile arthritis, our joint is attacked by our immune system. So when the healing comes, it is actually fibrosis comes. So the pliability of the tissue is gone, because the pliability and all is actually because of this protein integrity is there. Then only the joint will be flexible and pliable. This collagen, that is this joint capsule and the tendons are made of collagen. That is actually our immune system is attacking the collagen. That is a special type of protein there. So it is getting damaged. That is the reason why this joint damage happens. It's gradually, you can see the pictures of this rheumatoid arthritis patients and all the fingers and all the, even when I'm basically managing this clinically supported lifestyle correction, I'm giving actually clinical support for these patients to overcome from these diseases. It is for me, it is the osteoarthritis or the rheumatoid arthritis or the ankylosing spondylitis or the disc degeneration. Any of this disease is a inflammatory disease. So correcting the inflammation, avoiding the inflammatory source, that is what I'm doing actually. So whatever is the cause of inflammation, you have to correct it. When if you correct the inflammatory causes, you get the result actually.
Actually, regarding this arthritis, generally one of the major issues that is associated is knee problems, knee pain, knee wear and tear, then hip wear and tear. So, how does this osteoarthritis and rheumatoid arthritis be placed in this situation?
See, usually most of this surgeries, knee replacement and hip replacement is done for arthritis point of view. It is mainly for the osteoarthritis, that is the degenerative process. The degeneration means that all there are 2 joints, any joint, there will be 2 bones. The end of the bone is called cartilage. It's a soft bone actually. So that is actually acting as a shock absorber also. And in the joint cavity, there will be fluid also. Just like in any engine, there will be grease and fluid the oil will be applied. No? So just like it is the shock absorber and it is a soothing fluid will be there. Actually, this is getting damaged. Even the joint capsule, that is actually this joint capsule is the one producing this synovial fluid. That is the oil in our joint, or what is, it's not oil, it's a fluid. It's called a synovial fluid, and that is acting as a lubricant. So this production of this lubricant will be producing certain type of cells that is actually damaged. And also the joint capsule is getting damaged in the rheumatoid arthritis. So there can be this fibrosis of the joint capsule, and that way it get damaged. So, but in the rheumatoid arthritis patient, this type of joint replacement is not that effective because this can affect other joints also. How many joints you can surgically replacement of the artificial joint is only possible with the currently, I think, mainly only for the knee and the hip only. The other joints will be affected, especially the hand joints. Rheumatism, usually the hand also will be affected. We should recognize whether it is a distinction between the rheumatoid arthritis and osteoarthritis is very important. Because if the other joints, how it can be, the patient itself can decide. If you have only one or two joints of only the knee joint, it can be maybe because of the degenerative disease. Most of the such patients will be having overweight. These degenerative diseases usually goes along with the obesity. Other person also may be having this rheumatoid arthritis patient also can be overweight. But that the changes in the X-ray and all also will be very clearly showing it. But a patient with osteoarthritis can have rheumatoid arthritis also. Usually I have seen patients like many patients actually having a joint, one joint is replaced, right knee is replaced, but started pain and arthritis on the other joint. And after some time, that also is replaced. But other joints get affected. So osteoarthritis also, degenerative disease also can be affecting other joints also, even small joints also. So the problem is, if you replacement of the joint is not applicable for everyone, and actually it is not necessary also. If you are willing to correct your lifestyle, you can avoid knee replacement. Actually, you are developing into a stage of knee replacement very gradually. If you you know the pain is started and you start your joints are started bending or separate this some varus deformity, vagus deformity and all can come, especially for the knee. In that stage itself, if you are willing to correct, if you are willing to reduce the weight and find out what is the problems with your some food, if you have rheumatoid arthritis, some of the food you are taking may not be proper for you. So such food you find out which food is reacting to your body. Avoid such food and correct your body composition. That is, excess fat is there, correct it. And most of these arthritis patients will be their bone and joints will be weak. Strengthen your bone and joints with special joint. Arthritis patients cannot do all the exercise, running or walking and all is not possible for them, because that will actually aggravate. If you have a knee problem or hip problem, you cannot go for walking or jumping or such activities. You had to do only the floor exercise, sort of swimming or floor exercises are ideal for them. So you had to correct your lifestyle and correct. If you have excess fat in your body, it is actually acting as a toxin. Actually, it is actually this fat is actually troubling you, because the fat is the controller of your immune system. If you are having excess fat or the inflammatory fat, omega 6 is high, then you are in trouble. Your immune system is in trouble. The inflammation is activated. So you are getting the rheumatoid arthritis. And also even latest understanding is actually even the osteoarthritis also there is a factor of immune system deformity, because the immune system is actually in the osteoarthritis or in the this degenerative arthritis sort of thing, it is acting against the this cartilage, or even in the disc of the our vertebra. The there is also some cartilaginous. It's also a cartilaginous one, and also the disc is attacked by the immune system. So that is creating the degeneration. So if you are able to correct your immune system, this problem can be solved. You don't have to go for a replacement surgery at all.
Actually, when we think about the beginning of an arthritic episode, normally the treatment is usually in the nature of painkillers and inflammation reducing medications and all that. But slowly those don't seem to be effective, and then another range of medicines are then utilized. So regarding this approach of utilizing pain killing NSAIDs, what is your view on that?
See, when you have pain, you need relief. Actually, the modern medicine biggest advantage is we are able to relieve you from pain. See, this is inflammation. That is the pain is the sign of inflammation. Your immune system is getting activated. Actually, it is a signal for you. There is a problem. The body is telling you there is a problem. So you had to find out the problem and correct it. That is, the nature is given as pain, and all the inflammatory symptoms like pain, fever, tiredness, swelling, redness, all the 5 signs of any for any disease, all 1 or 2 of these symptoms will be there. So this is actually to protect us. The immune system is started getting activated. There is either a toxin is there. The toxin can be either a biological agent like bacteria, virus, or a chemical agent. So something unwanted is there. So the immune system is trying to remove it. That is the simple logic about this, or simple explanation for the symptoms actually. So what we are doing actually now, we have very effective medicines to block that. So we take the painkiller. If you have fever, you take anti-fever medication like paracetamol. That is so. Or even if the pain is not going without this NSAID, that is non-steroidal anti-inflammatory, then we go to steroidal anti-inflammatory agents. That is also very commonly used for this rheumatism, rheumatoid arthritis and all. It is very commonly used. And also there are other group like methotrexate and all. It is also actually it is an anti-cancer medicine, which is also blocking the immune system. And also we have HCQ, that hydroxychloroquine, that is also anti-inflammatory. So all the medicines, most of the medicines, maybe 1 or 2 exceptions may be there, but most of the medicines we are using in modern medicine is anti-inflammatory in one or other way. So it is in the pathway of the inflammation, and actually our immune system has two wings. One is inflammation and the other is anti-inflammation. See, inflammation is controlled by the omega-6 fat. That is a dietary fat actually. And another, this is anti-inflammation, that is healing and repair. That is actually controlled by the omega-3. Our modern problem here, all sort of diseases are, lifestyle diseases are increasing. This arthritis is a lifestyle disease, or rheumatism, or even the osteoarthritis, degenerative disease, which both is inflammatory. So what is the reason for this high incidence is, in our food, omega-6 is very high and omega-3 is very low. Generally in the nature itself, omega-3 is very low. It is only in very food items, sardine or salmon, fish, or in the algae, some sort of cold climate algae and water plants. It is not in the hot tropical countries, but in our place, even the fish in our lake and all, it doesn't have much of the omega-3 at all. Only the sardine fish which is coming from the cold sea to lay egg in our shore, we are catching it actually. They only have this omega-3. And in salmon in the temperate climate, they also have. So other food only for the leafy vegetables and very small quantity. And in our place, the urd dal or the some a few spices also have some quantity of omega-3. But the omega-6 is very high in all the nuts except the coconut actually. In Kerala people especially, we are using mainly the coconut oil and coconut. So we are blessed that there is no omega-6 in that. That is inflammatory oil is there. And there is no omega-3 also in that. But that is very good for the coconut is very good for energy purposes. It is very easily available energy actually. But the other nuts like groundnut, badam, pista, cashew nut, which all we consider is very tasty and we consume very frequently. It's almost 40 to 60% of that nut itself is oil. And about 40 to 60% of that oil will be, maybe 60% or more will be around omega-6. And none of this having any omega-3. So see the difference between disparity in this omega-3 and 6 balance. So that is the reason for all these inflammatory disorders. That is, the inflammatory disorders, these lifestyle disorders, is the reason is actually because of this immune system is in disorder. So immune system, omega-6 is high and inflammatory action is very high and omega-3 is very low. And also for the immune repair and the healing activity has to take place only when omega-3 should be there, and also this nutrients, 14 vitamins, around 14 minerals and 20 amino acids, and this omega-3 and 6 essential fat, all should be there, and also omega-9, that is also a body building fat. All these are, if it is in the perfect proportion, then you won't have any disease. We won't have any disease, we can't say, because if the attacker like a virus is so aggressive and you are not exposed to that, it will take some time for you to get immunity. So if it's a fresh, if your immune system is unaware of a virus, like even with the COVID came, so, but even definitely the chance of survival will be much higher if you have all the nutrition in the correct proportion, especially the omega-3-6 balance also in the correct proportion. You will be definitely in a better position to survive it. So when we come to the this autoimmune rheumatism, also the same thing applies. When you give the medicine, that is actually immunosuppressant actually. The problem with all the immunosuppressant, even it is NSAID or the steroid or the latest ones like biologicals or kinase inhibitors, they are all blocking the inflammatory parameters actually, and they may be having some blocking the healing aspect also. That is why with the medication, you are after starting, you'll be getting pain initially, pain relief. You'll be when you start the medicine, you'll get pain relief. But after some time, body will overcome that. The immune system will start reacting. So we'll be changing one medicine to initially maybe anti-inflammatory. Then we steroidal anti-inflammatory. Then we take metabolites like anti-cancerous like medicines like methotrexate. Kinase inhibitors and the biologicals are the latest ones. They are also acting in the same pathway itself. The problem with these newer ones is actually we don't know much of the data is there. But every day, we actually every month, one or two kinase inhibitors and these biologicals are coming into the market, and they are all fresh. There can also other side effects also. Side effects can be there, and all these medicines are interchangeably using for the autoimmune disease like rheumatism and also for the cancer also. So one biological maybe that is biological mean monoclonal antibodies actually. Usually monoclonal antibodies and kinase inhibitors, both this generally comes into this category of the biologicals. They are not only using for this rheumatism, they are using for the cancer also. So the side effects also can be when we use it for the cancer, it can create a autoimmune disease. And also for when you are using for this thing, it can trigger cancer episodes also.
Actually, when we are talking about this arthritis, generally another important part that is affected is shoulders and the spinal column. So, how does arthritis affect the shoulder joints and the spinal column? Because virtually almost anyone and everyone seems to be having back problems, back pain and all. So, is it got to do with this arthritis in any way?
Yes, definitely. It's very our spinal column or the vertebral column is very complicated joint actually. Each vertebrae is actually connected. The ribs are connecting to it. The one vertebrae has to connect with the upper vertebrae and the lower vertebrae and two ribs also. So there is so many joints are there. And also the main joint, that is intervertebral disc, is there. That is actually giving you flexibility, and for the vertebral column is because of this particular arrangement of this multiple joints in a particular fashion. This you are able to bend and walk and all. Movement is possible with the vertebral movement. Even the breathing movements, it is all connected. Actually, if you have a pain, the breathing can be, the lung capacity can be reduced because of this spinal column arthritis. So that also can be two types. Back vertebral column arthritis also can be mainly of two types. One is degenerative, that is we call the disc prolapse. The disc is getting degenerated and it becomes a bulge and it is pressing the nerves. And then you get the nerve pain. When it is pressing the nerve, you get the pain there, and also it can be referred to leg, the corresponding leg. And then we call it a radiculopathy. This is same happens if it is in the upper vertebrae, like a cervical vertebrae. We have 7 cervical vertebrae, then 12 thoracic, that is middle vertebrae, and 5 lumbar vertebrae. Usually the arthritis comes mainly for this degenerative arthritis mainly comes in the lumbar vertebrae and the cervical vertebrae. They are the actually most movement is taking place that part. And definitely if it is this problems happens in the cervical vertebrae, you may get the transferred pain, referred pain to the hand also. So and the shoulder also, that type of shoulder pain can occur on the shoulder, but the shoulder joint itself is a major joint that there also this hand muscles is inserting into the backbone, that is this collarbone, and also the scapula, the wing bone actually. So this is also complicated. So on that part also there are so many tendons, so many capsules, this collagen is there all. So it can also get affected. So it can be of degenerative and also autoimmune disease can affect it. Autoimmune this rheumatism can affect, and also the other this ankylosing spondylitis. That is another type of if it is the axial skeleton, that is the vertebrae is affected. You are calling it as ankylosing spondylitis actually. That is actually stiffening and calcium deposition in the ligaments also happens. So the flexibility is gradually reduced. So that is autoimmune type. So basically this degeneration and autoimmune disease can affect any joint, especially the spinal joints. When it comes to the spinal joint, it is much more difficult because the nervous system, your nerves are coming out of the this hole, that is the small canals in the vertebral structure itself. There is a outlet is there for the nerves. So there can be calcium deposits or the osteophytes. There are so many medical terms it is called actually. So it is actually damaging finally it can damage the nerves also. So the deformity can be crippling actually. So kyphosis, scoliosis, all sort of things can happen along with that. So there are problems are there, but the happy thing is you can control it also. But many of the things you cannot you can control with the medications, definitely that is there. But it is always better you come out of it. For coming out of it, the major thing is it all comes under lifestyle disease. And if you are willing to correct the lifestyle and to adjust your lifestyle with your genetics actually. Most of this autoimmune disease have a genetic predisposition also. So if it is this degenerative disease also having some genetic predisposition, definitely everything has a genetic and lifestyle factors are involved. Even if you have a genetic problem, like see, there is usually testing gene mutation we are checking is HLA-B27. If the HLA-B27 is positive, your chance for getting an ankylosing spondylitis or a rheumatoid arthritis is very high. So if your family is having such a history, you need not get it. If only that lifestyle parameters also is getting into wrong side, only you will get the disease. So if you have a genetic predisposition, you will be more conscious about correcting your lifestyle parameters. And lifestyle parameters correction means your body composition should be corrected, and also some food items or this toxin getting into your body. Even the excess fat in the body is the immune system consider it as a toxin. And this omega-3-6 balance, that is actually omega-3 and 6 essential fatty acids, which is controlling your immune system. Those aspects, if you correct, you can get out of it also. Or if you have a genetic predisposition, you need not get the disease at all if you are careful. So find out, we now it is a time we are doing even genetic testing. But genetic testing, it's well and good. We can understand it. Can test even the cancer risk, cardiac risk. But you should not think about you correcting it by medication. So medication is only manipulating your metabolism and immune system. So you cannot get out of a disease with the manipulation of the metabolism or the immune system, but you can get relief. Actually, pain and inflammation and this you can reduce. But when we can take the medicine and you get an interval period to a symptom-free period, and that period you use it wisely to correct your lifestyle. So if you are able to correct the lifestyle, you can come out of it if the deformities are not severe. But if even those patients, with my experience, even with some deformity and all, we can this rheumatoid arthritis, some finger deformity, and they are very with the difficulty walking. Everything they are able to come out of, even the deformity, some extent we can reverse it. That is the positive thing actually.
When it comes to patients who are having severe problems of movement and they can't walk on their own, they need the help of a walker or they need the support of others, or even to get up from a seat, they find it difficult. In such cases, what is possible if they are willing to look into a lifestyle correction system?
See, I am basically giving clinically supported lifestyle correction. This is applicable actually for the clinically for the lifestyle correction point of view. There is only few diseases. Either it can be autoimmune disease, or an infection, or metabolic disorder, or allergy, or a degenerative disease. For any of this kind of disease, the correction is in the same way to correct your body, to correct your body composition, body at the macro level, that is your shape itself, and at a micro level, that is at a cellular level. For that, actually, our body doesn't need any medicine. The body needs only nutrition. As till now, according to the broader understanding of the science, there are 57 nutrients, including oxygen and water. 57 nutrition, 14 vitamins, 14 minerals, around 20 amino acids, and 4 fatty acids, out of which 2 omega-3 and 6 is essential nutrient. They are also like vitamins, it has to come from outside. Your body cannot make omega-3 and 6 fat. So it has to be taken as you have to acquire it through the diet, just like vitamins. That is the difference. Vitamins, minerals, and this essential fat, you cannot make it in the body. It has to come from the through your food. And if you are able to, and to correct your body for a point of view of the autoimmune disease or the degenerative disease, you have to give correct nutrition, and also you should avoid toxins. The medicine is considered as a toxin actually by the body. So it will come to the liver and it is giving strain to the liver and the kidney. So it has to detoxify it and send it out. And the immune system will be concentrating on to detoxify it. So it is the responsibility of the immune system to protect you from the damages by these toxins. It can be biological, like virus also. So for a clinically supported lifestyle correction point or lifestyle correction point of view, what we are trying to give is to give enough nutrition and avoid toxin getting into our food, like colors, preservatives, tastemakers. Anything is actually a toxin for the body if it is not a nutrient. And even a nutrient which is in excess quantity, like glucose in diabetic patients. That glucose actually it's a food. They are eating the wheat preparation or bread or rice, whatever you eat. the excess carbohydrate is the troublemaker there. So you don't eat that much. That is a simple solution actually. For the type 2 diabetic patient, it is simply because you are overeating. So we had to understand that. And also excess fat. That is actually excess fat is a toxin which is stored in your body that is creating obesity. So why we are getting more of lifestyle diseases? Because you are stocking more fat, and if the fat is more, if you are taken more of nuts and this vegetable oils, your fat will be for more of omega-6 will be there. So it is inflammatory. It is natural to get an inflammatory disorder. So in this point of view, and also you had to get rid of this toxin. If you have stored these toxins, you had to get rid of. Many of these autoimmune disease, rheumatism and all, we see that any toxic elements like tin, arsenic, mercury, that toxic metals also is high in such patients. So we had to get out of it. How can we get out of these toxins? You had to do improve your circulation and improve your metabolism and allow the things to go out. So you had to do exercise. Actually, only the circulation has to be improved, then only you can burn this excess fat also. So excess fat you had to burn, and also you had to improve the circulation to get rid of these toxins. So that is what actually focused in this clinically supported lifestyle correction. And what my experience is for either it is rheumatoid arthritis or it is an osteoarthritis, whether it is degenerative or even this psoriatic arthritis with involvement of the joints. So some of the patients which comes will be having diabetes or hypertension also. They will be taking those medicines also. And they will be taking multiple. I had seen 3-4 anti-inflammatory medications. Like some same patients is taking one methotrexate, MMF, which is a very strong anti-inflammatory, HCQ, and steroids, this prednisolone sort of steroids. The same, or single patient will be taking all these medicines, and some may be may not be getting any benefit out of this, and they started kinase inhibitors like NIPS. That kinase inhibitors, usually the end of the tablet, the medicine name will be NIP. And also there are patients I had seen who are taking biologicals also, but they are not comfortable. They are getting some relief, but many of them are not comfortable. The body ache, most of this rheumatoid arthritis, the autoimmune arthritis patients may be having myalgia also. That is because this collagen is there inside the muscles also. That part is actually inflamed. So the whole body may be painful actually. So they may be needing support in especially when you to get up in the morning and to start activity, they find it very difficult. So all these patients actually whether and the other sort of patients they come, they are asked for a knee replacement or basically knee replacement patient, that is degenerative problem, and also back pain patients, all sort of patients we are giving. And in that actually what we are giving is actually for making sure that there all the bones, actually there is around 230 bones in our body and around 350 joints and 650 muscles. So making sure that all these parts are got activated by phased, specially modulated exercises, and also to get all the nutrient in the correct proportion, and if the patient is overweight, to reduce the calorie, and to see that what is the ideal food for, or the food which is not reacting from the body, or the food which is their immune system is reacting to that. When it is reduced, actually symptomatic release is very fast. Within 8th day, usually we recheck revisit us initially in the 8th day and the 15th day. By the 8th day itself, patients will be comfortable. Then we start reducing the medicines. And if the patient is diabetic, type 2 diabetes, the first day itself we can stop the medicine. And with this low calorie diet, with the anti-inflammatory diet, the diabetes within even patients who are taking 2 or 3 tablets and 2 or 3 insulin injections, they can also get out of the insulin and the diabetic medicines from first day itself. If it is a type 2, the type 1 in diabetes, you have to manage in a different way. So even the hypertension medicines and everything, we will be able to, most of the medicines will be come down within 1 month, and within 3 months, if the arthritis medicines, if it is many medicines, we cannot stop abruptly. One by one we had to taper off. First, if that tablet or one tablet we reduce to half and taper off. And then if the patient is improving, then we don't have to, the patient also will not be worried. And if the patient is diabetic, he can check the blood sugar at home itself and see the blood sugar comes down within 2 hours, you can see the result. And BP also within, if the BP medicine is 1 or 2, only within a week or 2 we can come out of BP. You can get a much better control of BP without medicine actually. So only thing, if the kidney is in problem, that it is BP control is a little more difficult. That's all. Even with the renal, there may be the GFR is down and all. It's not, if the only in the 4th stage or 5th stage, then it will be a little more difficult. So with the lifestyle correction, actually you're not coming out of one disease. Not only we are focusing on, the focus is not on arthritis or diabetes or alone. You can come out of whatever disease is there. If the damage is not too much, and if you're basically, the kidney function is very important. If you are in a kidney failure or any organ is failed, then it is very difficult to correct that part. But a patient is having a 4th level renal failure or liver 3rd or 4th, it is okay. We can regrow or repair it. But the last stage and the multiple organs, if you have already on cardiac failure, renal failure, and multiple problems, and also your joint is severely deformed, you cannot come out. It will not be helpful. So it is most important is you have to correct it. If you find it, don't wait for till you are deformed or you cannot manage. You find out the things early, and if you are starting, say if you are getting a knee pain, and if you have only that problem, and if you are saying that you are obese or you are overweight, just reduce 5 or 10 kg. You can come out of it. You can do it yourself. You don't need any clinical support, anything you need. You can come do it by yourself. And if you are only diabetic, if you are seeing yourself in a pre-diabetic condition, you just correct your lifestyle. Do some exercise and correct your calorie. You can come out of it without support. But if you are on multiple medication, and if you are on autoimmune disease and you are in pain, you are multiple medications, multiple disease, you need support. But with the correct support, you can come out of it very easily, and the symptom relief and all will be very surprising actually. You may be on multiple medication, but you are symptomatic. But your symptom medicines is reduced, but you are better symptomatic relief. That is, you can clear it with the diabetes if you have diabetes itself. After stopping all the medicine, your diabetic control is much better, because with the medicine your body is fighting your immune system, and the metabolism is derailed. The body's immune system is fighting with so many medicines and so many toxins. But when the medicines are over, your immune system is getting relaxed, and they can focus on what is really the matter. If you are joint repair, they will do it easily actually.
See, those who are suffering from rheumatoid arthritis normally we understand that their body composition is adversely affected, and because their body composition is adversely affected, their health otherwise degenerates. So, in such a circumstance, what is the treatment protocol to correct this body composition?
See, some patients, especially rheumatoid arthritis, they are already very frail actually. Even they may not be overweight at all, because the autoimmune disease actually reduce your appetite also. Unless they are diabetic and they are taking diabetic medicine or insulin injection, they will be usually may not be overweight, but they'll be over fat actually. Their bone and muscles, because of the pain, they are not able to do activities. When you are not doing activities, physical activities, you are not using your skeletal muscle. Not only your muscle is getting degenerated, your bone also is getting degenerated. Bone will become weak. Bone actually inside your bones, the immune system is residing inside your bones mainly. This inside the bone marrow. That is the place where the white blood cells, the immune cells, or soldiers are produced. So naturally, if the bone is getting weak, the muscle is getting weak, no activities, the circulation into the bone marrow is also reduced. So that way also your immune system is weakened. So to activate this or correct the immune system is what you have to give is, our body needs only nutrients. They need the correct nutrient, correct proportion. And the omega-3 is the healer actually. The body needs omega-3. And omega-6 is needed, that is the defender, that is the anti-inflammatory. But your quantity of that will be very high usually in this autoimmune disease patients and all the patients actually. The omega-6 will be high and omega-3 will be low. So correct it. That is what actually needed. You reduce the intake of this high omega-3, omega-6 nuts and oil seeds, and increase the intake of the omega-3 and burn the fat out. How to burn out the fat? You have to reduce the calorie intake. The carbohydrate and fat intake you have to reduce. And you have to do exercise. For a person with arthritis and all, it will be very difficult to do the exercise, especially in the pain. So in that period, I'm also giving those patients who have pain or the stiffness, mild anti-inflammatory agents, mild NSAID group, and also maybe a mild immunosuppressant also they may need it. So for a short time, usually some will be 1 or 2 weeks, or very rarely it may be 1 or 2 months. That's all it is needed. Usually 90% of the patients with the autoimmune disease will come out of this, they don't need this immunosuppressants or the painkillers. Without that itself, that is the way it is given. If you don't have pain, you can reduce and come out of it. That is the pattern. And also we follow with this autoimmune antibodies also, like rheumatoid RA factor and anti-CCP, and you can see that also comes down. And also the inflammatory factors like ESR, CR, C-reactive protein, and the blood count itself, WBC count itself will be very high, not very high. When it's very high, I think it is going into cancer, but it will be moderately increased without any fever and infection. When you take a CBC or the blood count, if without any infection, if the WBC or count is increased, that means there is an inflammation. You can go either to autoimmune disease or you can go into a cancer. It's all in a different aspect of inflammatory, or none of these diseases standing alone. Actually, the cancer also in inflammatory disease. They are also the reason for the excess toxin, lack of nutrition. It's the same thing, but it is the immune system is acting in a different way in different diseases. Even we can see that rheumatoid arthritis patients, some patients the hands may be more affected, some patients the leg may be, toes and other joints can be affected. Some autoimmune diseases can affect this, like ankylosing spondylitis may be affecting the spine. But the only thing, it's all different manifestation of a same problem, that is the immune system. Actually, we should understand that whatever medicine is given, it is actually either modulating in the, you are actually suppressing or blocking the immune system to get relief from the pain. Actually, the true healer or real doctor, everyone has a doctor inside them. That is the immune system. That is actually very highly protected. Immune system is very highly protected and it is dispersed in our bones actually. And there are, as I said, there are 230 bones are there, and each of the bone is a source of it's a part of the immune system. So even you know that maybe someone has who has gone to a bone marrow biopsy, if a blood cancer or a multiple myeloma, you are doing a bone marrow biopsy. Actually, you are pricking on the this chest bone itself, the sternum, or in the hip, that is the pelvic bone. You are taking needle into the bone marrow and taking it for biopsy actually. So actually our doctor, everyone has a doctor and it is dispersed in our 230 bones, and also the sub centers are there. There are so many immune system settlements are there, like our tonsils, adenoids, and also the lymph nodes. They are all part of the immune system. So it is all over the body, the immune system is there. They are actually the healer. Only the doctor or the hospital or the surgeon can help the immune system. If you when for the COVID we had given injections, the vaccines, that is actually to prepare the immune system. Or what you can give antibiotics, antivirals, to support the immune system to kill the bacteria. So antibiotic will kill the, but kill the bacteria, or antiviral is to kill the bacteria. But we have to understand that even this medication is it's a toxin for the body. That is why we are getting side effects. Even for the vaccines, there can be side effect. Antibiotics, there can be side effects. That's why we are intense monitoring of the kidney function, liver function, and bone marrow depression. That is the one thing which can, that is the immune system itself can be suppressed. That's why we are checking the blood count. If the blood count is going down, or if the liver function is derailed, kidney function is derailed, we have to stop the medicine, whatever help it can do. So that we should understand that the real healer of our body, the real doctor, is your own immune system. So empower it with the empowerment of the immune system with nutrient, avoid toxins, and give so when you take the food alone, you don't reach all the cells. Only the cell which is activated, where the blood will flow into that. So you need the physical activity, or the activity you have to. If you are sick, you cannot do severe major activity, or if you can be all the system can be weak. So in a phase, only one part. It's a systematic way you have to activate all the bones in your body, all the muscles in your body, all the joints in your body. So only thing you can do it consciously is only to activate your skeletal muscles. So all the other things will come activated, like heart, liver, pancreas, kidney. Everything will be activated when you are activating your skeletal muscles. That is the only thing you can do the consciously. So understand that and try to correct your lifestyle. These all diseases comes under lifestyle disease, and understand that it is not due to lack of medication we are getting the disease, or lack of surgery you are getting the disease. So it is not the basic understanding. You have to, everyone should understand that it's all lifestyle disease, and the body needs only nutrient and activity and protection from toxins. So if you can provide that, you can get out of, and you can give lead a healthy life, which is for the lifespan, which is mentioned for the body.
I think the time for the discussion is over at present. Thank you.